The ZUMA-1 trial was a CAR T-cell therapy clinical trial testing out axicabtagene ciloleucel, a CD19 CAR T-cell therapy developed by Kite Pharma, for patients who had diffuse large B-cell lymphoma, primary mediastinal B-cell lymphoma, or transformed follicular B-cell lymphoma. And these patients had not responded to their last line of chemotherapy. They had, at best, had stable disease, or they had relapsed within 12 months of a prior autologous hematopoietic stem cell transplant. So these patients were enrolled on the ZUMA-1. The results were quite remarkable. We had very high response rates, over 80%, and in fact, durable responses were seen in over 40% of patients with a 15.4-month follow-up. And at ASCO, we looked at the durability of responses and what could predict for durable responses. We knew that patients who achieved a complete response following a single infusion of CAR T-cell therapy could expect to be in remission for many, many months, perhaps indefinitely. We also knew that patients who at best achieved a partial response did not fare as well. And so we looked at the differences there. We also realized that patients who achieved a complete response, many of them, a third of them, initially achieved a partial response. So patients were having deepening responses over time. So we're interested to look at the relationships between the responses. Most of the progression events were occurring within the first 3 months after therapy, and so we decided to look at the 3-month time point after CAR T-cell therapy as an important time point for decision-making for physicians and patients who have had CAR T-cell therapy. Initially, we looked at the time to response following a single infusion of CAR T-cell therapy. What we found is that most patients responded 1 month after the therapy, had an objective response. However, not every patient had a complete response. Some patients had a partial response, and many of those patients' responses deepened over time. 41% of patients who achieved a partial response eventually had their response deepen to a complete response. Most of those occurred by the 3-month time point. However, some patients continued to have deepening responses. Some as late as 1 year after a single infusion of CAR T-cell therapy had a conversion to complete response. And so that told us that these patients who have a partial response have a chance to obtain a full remission if they're followed over time. And in fact, when we did a landmark analysis 3 months after a single infusion of CAR T-cell therapy, the patients who were in remission 3 months after a single infusion, those patients have an 80% chance of remaining in remission beyond 1 year, and that's whether they have a complete response or a partial response. What this tells us is that for these patients, we really ought to not be doing alternative therapies. We shouldn't be giving them a stem cell transplant. We ought to continue to follow those patients because they have a very good chance of maintaining remission for a year and longer. The other abstract that was selected as a best of ASCO abstract that had to do with CAR T-cell therapy was an update on the TRANSCEND data. It was presented by Jeremy Abramson at the ASCO 2018 meeting, and what this abstract did was presented longer-term follow-up results from the TRANSCEND study, which was testing out an anti-CD19 CAR T-cell therapy, also for patients with relapsed refractory diffuse large B-cell lymphoma. These patients had, many of them had high-risk features, including double-hit and triple-hit lymphoma, and about half of them had refractory lymphoma, meaning they hadn't had no response to their last line of therapy or relapse within 12 months of a prior autologous stem cell transplant. The response rates seen in what they're calling the full cohort and the core cohort of the study were remarkable and in line with what's been seen with other clinical trials of CAR T-cell therapy. And importantly, the durable responses, patients who remain in remission 6 months after a single infusion of the CAR T-cell therapy, which in this case is called lysocabtagene maraleucel. That's the CAR T-cell therapy being tested on the TRANSCEND study, which is run by Juno Therapeutics. Patients who received a single infusion of lysocabtagene maraleucel, the 6-month objective response rate is close to 50%. So half the patients remain with a response 6 months after the therapy. One important thing to note is that on this clinical trial, patients were allowed to have their cells collected for manufacture of CAR T-cell therapy, and then they were allowed to get bridging chemotherapy. So they undergo apheresis, cells are collected, shipped out to the centralized manufacturing facility, then they could get chemotherapy while they waited for the CAR T cells to come back. That may have helped some of the patients who had rapidly progressive disease, but what it also did is it shrunk down the amount of tumor burden. And in fact, on the ZUMA-1 trial, that bridging therapy was not allowed, and that may account for the lower toxicity rates seen on the Transcend study. In fact, they're remarkably low. Severe toxicities were seen in only the cytokine release syndrome. Severe toxicities were seen in a small number of patients, as well as severe neurotoxicity, significantly less than seen with other CAR T-cell therapies. And it remains to be seen if this is because it is a less toxic therapy or because these patients had lower tumor burden. But it's actually certainly intriguing and something we'll be following for some time.